I understand that the following information will be gathered and utilized for educational purposes by an Indiana Wesleyan University student. I give my permission for this information gathering and physical assessment to be filmed and posted for access by faculty and students at Indiana Wesleyan University.
Outstanding. All right. How are you doing today?
Okay.
Doing okay? Good. I'm going to ask you some questions. These questions are basic questions that we ask everybody, so don't feel like I'm trying to intrude. It's just standard questions. Okay. So you came in today. From what my CMA said is that you came in today for some asthma and some coughing, and you believe you have some postnasal drip. Is that correct?
Yes.
Okay. Your temperature was 98.3, pulse 72, respirations 16, blood pressure 128/74, and your oxygen level is a little low at 95%. Are you having any difficulty breathing today?
A little.
A little?
Yeah.
Okay. Have you noticed, now with the cough, are you having a productive cough at all? In other words, are you getting anything out?
No.
No? Okay. Okay, sounds like maybe you might have some something just kind of, does it feel like you have something irritating? Or?
Yeah, just mostly in my throat.
Okay. Okay, I got you. All right. Little history, if it's okay. I'm going to give a little history on our patient, Kai. She's active in her church. She's kind of really into her career and active in her community. She's kind of what we call in the generativity portion of her life. She's also Native American, and can you tell me a little bit how you're involved with that?
I work at a Head Start program.
Okay.
Done by the Fairbanks Native Association,
okay.
which is a Native entity, and I am working with children who have Native American in them.
Sure. So you probably got this cough.
Yeah, from the kids.
From the kids.
Yeah,
right?
Working with the kids. This is just one of the things going around.
One of the things going around, and then thank goodness you come home and you share with the rest of us. I appreciate that.
Yes.
Okay, got you. Okay, so I'm just going to ask you a couple other questions. Do you feel safe at home?
Yes.
Have you felt depressed in the last couple weeks?
No.
No. Okay. Have you had any thoughts of self-harm or harm to others?
No.
No. Okay. Good. Good. That's good. Okay. Well, part of your medical history a little bit is that you've had problems with asthma. You've had issues with chronic bronchitis, some sinusitis, you've had headaches a lot from having those issues, and so a lot of physicians have done just symptom management instead of actually treating the root cause. Okay, so right now your medications are fluticasone, nasal spray, correct? Singular.
Mm-hmm.
And albuterol inhaler, and cetirizine. And how do those work for you? Obviously, you're sick, but
they work okay. But the best thing so far has been a Neomed sinus rinse that I do daily.
Sure.
That has helped to clear up a lot of the
sure.
sinusitis that's been going on.
Good. Good. Okay. And has that helped any with your postnasal drip?
A lot.
Sure.
Matter of fact, a lot of the postnasal drip is being alleviated.
Cool.
And
That's
I had a
nice.
Clogging in this ear, but because of the sinus rinse, it's been helping clear that up. Weird thing to try, but it works.
Okay, so at times, do you have any what we call dyspnea? Have you had any shortness of breath?
Usually towards the evenings.
Okay.
Yeah, towards the evenings, I'm feeling out of breath.
Okay, and what do you do for that?
What I'd like to do, but I haven't been able to do, is a nebulizer treatment.
Sure. So
that works better than just doing a couple puffs with an inhaler.
So you're working on getting that equipment
yes.
and stuff like that. Okay, we might have something to loan you here. Have you had any anxiety with that? Have you ever been anxious, not being able to breathe? How about chest pain? Have you had anything?
No.
That hurts. Okay. All right. Well, I'm going to just take a quick list to you, if that's okay. And and see what I can feel or hear. All right. I just want you to breathe normal. Okay. Breathe normal. Breathe. Breathe. All right. Breathe. Okay. Take a deep breath. Okay. And have you kind of turn that way real quick. Okay. Breathe. Breathe. Okay. Breathe. Sure. Breathe. And one more time. I know you're about ready to. All right. All right. All right. Do you have any pressure right here? Does that relieve any pressure?
No, no pressure there.
No real pressure today?
Mm-mm.
Okay. Any swollen? Okay. Yeah. All right. Well, I didn't really hear anything in your lungs, which leads me to believe that it's probably more up here, but we'll let the doctor decide that as far as why you have postnasal drip, and I don't really appreciate anything in your lungs. Now, at the basis, it's a little diminished, but that can be because of your asthma. Okay. Doesn't look like it's anything as far as sinuses, because you don't feel like you have any pressure, and pressing on these points can kind of relieve that pressure if you're having some issues. Okay. And I'll let the doctor know that. Okay. All right. Well, I appreciate your time. Appreciate you coming in. I will go get the doctor, and he'll come in and have a talk with you. And then if he has any other instructions for you, I'll come back in and give you those instructions. And thank you for your time.
Thank you.
Okay. Bye.